Hello, my name is Casey Broussard, and this presentation is being conducted in fulfillment of a course requirement for Brandman University Online. This presentation is prepared for any and all stakeholders that are required to facilitate making my project possible. My clinical scholarly project focuses on geriatrics greater than 65 years of age that have been previously diagnosed with heart failure and find themselves trapped in the revolving door of hospital readmissions. The main objective of this project is to determine whether or not introducing nurse practitioners into the equation, specifically during the acute phase, which would be immediately post hospital discharge, will make a difference in these patients' lives. So, who are the stakeholders? The stakeholders are any person or group that has concern and or may be affected by this project. In this case, they include any physician that agrees to participate, nurse practitioner, family members, and other caregivers involved in the patient's life. Each person's role is different, and therefore the education plan may vary slightly for each participant. For physicians, their function is the primary caregiver, and the only education that seems required is an overall explanation of the project motive and anticipated outcomes. Now, the physician is also the stakeholder that provides the list of patients, possible candidates that meet criteria needed to conduct this study. The family member and other caregivers may require more education. They will be educated on what the overall problem is, a brief review of what has already been done and implemented to try to resolve this issue, and the anticipated outcome of that we're hoping for of implementing a nurse practitioner into the home care setting post discharge. Their participation in this project is highly requested and also appreciated to facilitate accurate responses during any survey that may be given or questionnaire issued to complete this project. As far as the nurse practitioner, the role for this person is this project may be required for feedback. It's preferable that this NP is already engaged in working as a transitional nurse care practitioner in a home setting in collaboration with the physician. And as with the physician, the only education that seems required is about the overall project and what is being measured in this project. There should be no cost involved for any of the participants. The only loss for anyone may be the family members and caregivers, and it's because of the time that we're requesting that may be committed to facilitate this study. As far as theories and conceptual model, the nursing theories that may apply more to this particular project are self-care deficit theory and health promotion models by Dorothea Oram and Nola Pinder. In Oram's model, the condition that validates the existence of a requirement for nursing in an adult is the absence of the ability to maintain continuously that amount of quality of self-care, which is therapeutic in sustaining life and health, in recovering from a disease process or injury, or in coping with any effects from the recently developed disease process. Likewise, with Nola Pinder's health promotion model, this model notes that each person has unique personal characteristics and experiences that affect subsequent actions. So the set of variables for behavior-specific knowledge and affect have important motivational significance. These variables can be modified through nursing actions, and in this case, the actions of the nurse practitioner. Both theorists realize that while each person is a unique case, in order to obtain the best possible results in care, the medical provider must be present, and the patient and caregiver must have an internal drive and be active, proactive in this matter. The conceptual framework is simply patient-centered, with open lines of communication between the physician and nurse practitioner with the patient, family member, and caregiver. This process can only be successful with positively receptive candidates. So to sum it all up, a general idea of what is expected is a literature review will be aggressively conducted on transitional nursing care with heart failure geriatric patients. to see where they are in conjunction with a survey that will focus on outcomes over the past 3 months with this population. Upon completion of this project, the participants will be notified of the findings. Thank you very much for watching my presentation.